conversations, and education on relevant health issues management. Hello, Doc.
Hello, Doc.
Make a date with our health professionals on the drive with the area gang. Mondays 2:45 to 3 p.m. Hello, Doc. Hello, Doc.
Hello, Doc.
Okay, so you welcome back. This is PLUZZ 89.9 FM across music leader. We are on the drive with the area gang. It is time for our weekly health feature. We call it Hello Doc, and we have with us here in the studio Dr. Emefa Dzide. She's a senior medical officer at Agbawe Municipal Hospital, and she's joining us to talk about breast cancer today. Good afternoon to you, Doc. No, your microphone was off. Yeah, it's on now.
Okay, good afternoon,
You're welcome.
Yeah.
How you doing?
Oh, by God's grace, as usual.
Oh, okay. You know, I've never really paid attention to your hair. I'm only now paying attention. It's like natural, like it's dreads.
Yes, it
Oh, okay. You Rastafarian? Are you Rastafarian?
No.
So this is just fashion?
The hairstyle, yes.
Oh, okay. You're not vegetarian or anything also?
No.
Oh, okay. It actually suits you. I've never taken notice of it. I'm only doing that today, and I was wondering, like, so Doc, all this time, she be Rastafari. Anyways, month of October is a critical month, because we take a look at breast cancer. We do a lot of education about breast cancer. And so that's what we'll be doing. I'm sure in the course of the month also there's going to be a lot of screening and all that.
Yeah.
So throughout this month, we'll be doing some series on educating people on breast cancer, and we're starting today. First of all, let's do the basics, and find out what is breast cancer.
Okay.
Or let's break it down, because usually I like to break them because there are two words here. There's breast and there's cancer. I know breast. Everybody knows breast. I know some boys say they like the way they like breast, but they always do. They go under the pretext of breast cancer. They say that one of the myths that I want us to bust later on, that if you squeeze a breast, then that person doesn't get breast cancer. We'll get to that later on. But talk to us about breast cancer.
Okay, yeah. So cancer in itself is an uncontrolled multiplying of the cells in the body. So any part of the body, if the cells begin to start multiplying uncontrollably, that's cancer. So when it's the cells in the breast tissue, then it's breast cancer.
Okay.
So usually those cells, they don't go through the normal process of growing and maturing and all that. They grow very quickly. They don't mature to like the states where they can actually function well, and they just begin to multiply. And then when they do this, they begin to suck up all the blood, oxygen and nutrients that should be going to the normal tissues. They suck it all up. Sometimes they excrete or they release certain chemicals into the body, increase a lot of waste materials into the bloodstream and all those things. And so all those things put together is what causes actually the devastating effects of cancer. So it can spread either through the bloodstream. Some of the pieces of the chunks of the tissues would go through the bloodstream and go and land in other organs of the body, and then start multiplying there as well. And also just what they produce can also cause failure in the kidneys, in the liver and all those things. When they go to the lungs, they just multiply and then occupy a lot of space in the lungs, and the person can't breathe well and all those kind of things. So basically that is breast cancer.
Sounds dire. You just scared me. I'm like, when we talk about it, like, we take it normal, like, breast cancer.
It's a serious condition, actually.
How prevalent is it in Ghana?
That's also a very good question. You see, the issue is that there are lots of people who are not getting tested for breast cancer. So we can't really give a good prevalence, because from what the studies that have been done, the most recent one says is 4.5% of the population that actually screens for breast cancer. So we can't really tell. There are lots of people who are having breast cancer at home and all those things, not coming to the hospital, going for herbal treatments and all those. But in numbers, we have about like 4,000, 4,500 people every year being newly diagnosed with breast cancer, and a lot of them end up dying from breast cancer.
I was going to ask that because ultimately cancer will kill you, right?
If it's not treated, yes.
Yeah. So, how does the numbers look like in terms of people who die from breast cancer? Generally, how does it look like?
It's not really a static number, and it really depends on the stage at which the cancers are found. So it differs from year to year, so I can't really give a specific value.
Okay. All right. Let's go to the types of breast cancer that we have.
Okay. So the types of breast cancer, well, it depends on which specific tissue or which specific cell has gone rogue and is multiplying. So we have the angiosarcoma, that's from the blood vessels within the breast that starts multiplying. Then we have the ductal carcinoma, that's from the ducts through which the milk passes through. That could also come. Then we have the lobular one, so the glands that produce the milk in the breast tissue are the ones that get affected. We have what we call inflammatory breast cancer, and that one it looks like the breast is inflamed, it's like reddened, so it's like a generalized something, not necessarily a lump per se. And then we have triple negative breast cancer. It's very, very aggressive, and then it spreads very, very quickly within a short period of time. Then we have Paget's disease. Usually affects the skin and then the nipple. So you see that there are changes in the nipple, or there's unusual discharges coming out of the nipple. So those are basically the types of breast cancer.
You mentioned one. You said the inflammatory one usually will not come with a lump or something in the breast, because I know that for screening, when you're screening for breast cancer, you are looking for lumps in the breast. But you are saying that there are some that you might not find lumps there, but you still have breast cancer.
Screening is not only looking for lumps. We are examining the whole breast. So you will see abnormalities in the skin, you will see abnormalities in the nipple. You will be able to, if you know what you are looking out for, you'll be able to see sometimes the breast will be enlarged more, one breast enlarged very much more than the other one, not the natural difference in size, but you see that a sudden increase in the size of the breast.
All right, we're talking breast cancer today and for the rest of the month of October on Hello Doc here on the Drive with the Area Gang. Now we'll not be able to take comments from you or questions from you today, but you can send your questions ahead of time so that in subsequent weeks we'll put it to Doc and hopefully we get some answers to that. Doc, let's look at the primary risk factors or some of the causes for developing breast cancer.
So breast cancer is more common in females than males. So being a woman, you're at a higher chance of breast cancer. But 1% of breast cancer also occurs in males. So just because you are male doesn't mean you are free. You could also have a chance, but it's a higher chance for females. Age, usually 50 or 55 years and above are at a higher risk. If you have a history of having breast cancer before, that maybe you treated and then you were cleared, you are still at risk. So having a history means you've
developed it before. You still can get breast cancer even if it's been treated. Wow.
That's if your breast was not surgically removed. So family history, if you have a relative, especially a closer relative, your mother, your sister having breast cancer, it's a higher risk of you also developing breast cancer. Genetically, there are some genes that have been found to be associated with breast cancer. So sometimes, even if you don't have a family history, but if those genes are within your DNA, you have a higher risk. Then there's exposure to hormones or estrogen. So if you had your first menses before the age of 12, or you go through menopause after the age of 50, that means your body has a longer period exposed to the hormones, the estrogen and the rest. And so that is also a risk factor of developing breast cancer. Then the usual smoking, smoking is always a risk factor
Oh,
for
really?
all the cancers.
Okay,
yes.
okay.
So
okay.
smoking cigarettes.
So I'm thinking smoking, you're talking lungs or something, but it can affect
Yes,
the breast as well.
any cancer actually.
Okay.
Drinking alcohol excessively. Yes, so if you're an alcoholic, you are also increasing your risk of breast cancer. Obesity is also increases your risk of breast cancer. And then radiation exposure. That's not maybe if once you went to do X-ray or something, but if you went through some radiation therapy, radiation treatment, and you were exposed to the radiation for longer periods, the X-ray is like just 1 second exposure, and so that is not likely to increase your risk. But if you took some radiation treatment, that would increase your risk of developing breast cancer.
Radiation itself is used in treating cancer, right? I'm thinking that you're going to treat cancer and then you come back and then it's actually exposing you to some different form of cancer. I don't know.
Possibly.
Okay.
Yes. And also, but those radiations are actually quite targeted. And
Okay.
yeah. And then the last one is hormone replacement therapy. So especially those who go through menopause.
Okay.
And because of the symptoms of menopause, they are treating it with hormone replacement. So they are taking some estrogen supplements to prevent the symptoms of menopause. Those supplements actually can cause or give you a higher risk of developing cancer.
Okay. Are these prescribed or?
Yes, they are prescribed.
They're prescribed.
Yes.
Okay. Could be taking in some.
So you should be able to know those risk factors when you are going in.
Okay.
Yeah.
Now let's look at this. Two things that I want us to look at. We'll bust some myths, but let's look at signs and symptoms that we need to look out for.
Yes. So the commonest sign is when there is a mass or a lump in the breast. So you feel it's sometimes you might not see any sign of it, but when you press and palpate, what that's the medical term for.
Yeah.
So you
But we
actually
like the
feel-
press. We call it Bobby press. You press the Bobby and then you.
Yeah. So usually that's the commonest symptom that people get. So they feel the lump. Yes. Another one is change in the size and the shape or the contour of the breast. So you see that a part of the breast has just gone inward and it's abnormal, not the nipple, but some aspect. Or sometimes you see like as if the skin of the whole breast is swollen and it looks like orange, the outer surface of orange, how it looks with holes.
We should be paying attention to our wife's breast too,
Yes,
so that when. But this is you're talking about like it's news to me. I don't know. I don't remember ever looking. You know.
You should really look and then help and then examine the breast very well. Yes.
Okay.
So sometimes there's also a thickening in the armpits. So you feel something in the armpit. Usually that's what we have called the lymph nodes.
Okay.
So when there's a cancer there, it goes into the lymph node. So you feel there's some thickening or there's some masses under the armpits. Yes. So that could also be a sign of breast cancer.
Okay.
And sometimes the nipple might look scaly, dry. It can like become flat or rather go inwards instead of coming outwards. Yeah. And then also there could be a discharge from the nipple. Not breast milk, it could be maybe a clear like watery kind of discharge. Sometimes it could be a bloody discharge as well. You would know that this is an abnormal discharge because you shouldn't be discharging from your breast if you are not breastfeeding.
Okay.
So once you start discharging, it's a possible sign of breast cancer.
Sometimes. Okay, no, this one I won't say it. let's bust some myths.
Yes, so-
What are some of the myths associated with breast cancer?
Okay. So I have a few here.
Okay.
So if you don't have a family history of breast cancer, it means you can't get breast cancer. That is the number one myth. So if no one in your family has, you think you are free. And that is not true.
Okay.
A lot of people don't have any family history.
And they
but
get
then
breast cancer.
They get breast cancer.
Okay.
Yes. Okay. Then
That's good to know.
the next one is if you maintain a healthy lifestyle, you keep your body weight, you don't take alcohol, you don't smoke, that means you will not get breast cancer. That is also not true. There are people who do everything right, but then they still end up
Getting breast cancer.
breast
You probably would be reducing the risk by doing all that,
Yes.
but not that you'll be free from breast cancer.
Yes.
Okay.
So then wearing a brassiere can cause breast cancer.
Yeah.
Yes.
Especially they say if you wear it for too long. Because there are people there are some ladies I know who wear brazier like the whole day, even in the evening, until they are going to retire to bed before they remove it.
Yeah, well, there are disadvantages to wearing the bra to sleep and all those things, and it's not advisable.
Okay.
But we haven't really found data that actually links that wearing the brazier does actually directly cause breast cancer. Yes, it causes other issues, but not breast cancer specifically. Another myth is using the deodorant sprays and those things cause breast cancer. Yes, a lot of people have that notion.
Oh, I've not heard that one.
You haven't? Oh, then we are hearing things.
Okay. Well, I mean, you are at the hospital, so you hear stuff.
Yeah, so that is also not true. Yeah, there is no connection with deodorant sprays and breast cancer.
Okay.
Yeah, so you can use your deodorant and be free. All right. Carrying a phone in your bra can cause breast cancer. We don't really have any evidence to show that that's actually a cause of breast cancer.
Okay. Yeah. But there's radiation, so maybe you don't want to carry it in your bra. I don't know. Why would you want to put the phone in your bra? For safekeeping?
I don't know. Usually the market women do that a lot.
Yeah.
All right. So consuming too much sugary foods can cause breast cancer. That is not true.
Okay.
Too much sugary food is not good.
It's not good anyway. I mean,
but that is not necessarily the cause of the breast cancer. So when someone gets breast cancer, then their relative will be saying, because you have been taking all the sugar and making them feel bad and all those things. That is not the cause of the breast cancer. It's an unhealthy lifestyle, but it's not the cause of breast cancer.
How many do we have to go because we ran out of time?
Oh, okay, just 2 more.
Okay.
The breast cancer always comes with a lump in your breast. That one I've already mentioned that. And breast cancer only occurs in older women, and that is not true. About maybe 16-15% of breast cancer cases are in younger women, less than 50 years old, sometimes in their 30s. I've seen a couple in their 20s who developed breast cancer.
Okay.
So it's not only for the older women.
Okay. And throughout the month of October, that's what we'll be doing.
Yes,
so
please.
Whatever we've not touched on today, we can touch on next week. But I thought we were going to say one thing. They say if you press the bobby, you won't get breast cancer. So they encourage the men, to be squeezing. That one, you didn't mention it. Is it true or not? I want to know. Because the boys, they want to take advantage of it and then be pressing here and there.
No, I don't know of it being a preventative measure.
Doc, please do your research. Next week, please come and tell us. Do your research and let us know next week that it's true or not. Because I need to address some boys.
Okay, but one last thing I want to say is at the district hospital, the whole month, we are doing free breast examinations for women. So if you are in the area, you can pass through the wellness clinic, or if you come to the OPD, the nurses or the prescribers there will examine the breast for you and let you know.
Critical for us to do that this month of October to prevent breast cancer in ladies. Thank you very much, Doc. Beautiful insights. Thank you for coming, and I will hope to see you next week.
Yes.
All right, so that is Dr. Emefa Dzide from the Wejagbawe Municipal Hospital talking about breast cancer for today. And like I mentioned, if you have a question that you want to put to Doc on breast cancer or for that matter on any other health issue, send us a WhatsApp message or a normal message 0505751151. Just leave a message over there. Next week when she comes, she'll try to address it for you again. It is 0505751151. This is a drive with the area gang. We just done with Hello Doc, and up next Michael Eklu will join us with